Hey folks, welcome again, and today we are going to talk about the diseases of the eyelids part 2, and today we are going to talk about the hordeolum. So first of all, a brief overview. We have classified the diseases of the eyelids into the inflammatory, anomalies, congenital, and tumors, and we were talking about the inflammatory diseases, in which in the previous video we have covered the chalazion, and today we are going to talk about the hordeolum. So basically, the chalazion and the hordeolum, these two are the focal inflammations of the eyelid, whereas the blepharitis, that is the diffuse inflammation of the eyelids. And all of these three are inflammatory, means inflammation occur in all these three. So now let's talk about the hordeolum, that what exactly is hordeolum. So hordeolum is an infectious pyogenic swelling. So it is an infectious pyogenic swelling. Let me remind you of the previous one, the chalazion. In that we have studied that is a non-infectious swelling. However, hordeolum is an infectious swelling, and since it is infectious, it's also pyogenic infectious. So means there will be pus present and of the eyelid due to the obstruction of the ducts of the sebaceous gland, followed by a localized infection. So over here we will have the same case, that there will be obstruction of the ducts of the sebaceous gland, but unlike the chalazion, over here we will have the localized infection as well that will follow the obstruction, and mainly the infection will be caused by the Staph aureus, and it is also associated with the boils, carbuncle, and acne over the face. As you know, the Staph aureus also causes all these skin lesions, that is the boil, carbuncle, and acne, that are caused by the Staph aureus. So since it is an infection of the Staph aureus, so this will also be associated with that, and the patient will give history of that as well. Moreover, it will be a pyogenic swelling, that the swelling that appears in the hordeolum, that will be pyogenic swelling, and it appears as a purulent abscess since it is forming pus, and it will be looking like an abscess that is forming pus. So hordeolum, things to remember, key point is that it is an infectious pyogenic swelling, whereas the chalazion was non-infectious swelling of the eyelids. Now let's talk about its type. Now there are two main types of it, that is Hordeolum externum and Hordeolum internum. Let me remind you of that the hordeolum is actually the infection of the sebaceous gland. And now if you remember the anatomy of the eyelid, we have covered that we have two types of sebaceous gland in the eyelid. One are present anteriorly or externally, that are called as the gland of Zeiss, whereas the other is present inside the tarsal plate, that are called as meibomian gland, and that are typically anterior if you look in that way. Here is the anatomy of the eyelids. Again, you have skin, then you have muscles, and you have this levator palpebral muscle. Its fibers are coming all over here. Then over here you can see that at the hair follicle you have two associated gland with it, the gland of Zeiss as well as the gland of Moll, and on the other hand in the tarsal plate you have the meibomian gland. So of these, the meibomian gland as well as the gland of Zeiss, these are the sebaceous gland. Now we have two types, the Hordeolum externum. Now in the Hordeolum externum, what will happen, that there will be infection of the Zeiss gland, the external gland. So the Zeiss gland infection, that will give us Hordeolum externum, whereas the infection of the meibomian gland, that will cause the Hordeolum internum. So now let's move ahead. This is written in the text. Now let's move ahead. The Hordeolum externum, that is TI. So Hordeolum externum, as we have explained it, that it is acute suppurative infection of the Zeiss gland, the external gland. The causes is, again, there will be obstruction of the Zeiss gland, and that will be followed by an infection by Staph aureus. As far as its pathogenesis is concerned, we have said that the obstruction of the orifice of the Zeiss gland will occur. That will lead to the retention of the lipids, and once the retention of the lipids occur, so that lipid retention make this area very much prone to the infection. So the Staph aureus is welcome in this environment, and it infects this Zeiss gland, and once that is infected, it produces pus by fighting with the neutrophil and all that stuff. So dead bacteria as well as the neutrophils and all that stuff form the pus, and that pus accumulation and inflammation, so that will form our characteristic swelling that is called as hordeolum externum or stye. And the one key feature of it, that it will be a painful swelling. Let me remind you that the previous swelling that we had, the chalazion, so that was painless swelling. However, hordeolum will be a painful swelling. So that's all about its pathogenesis and etiology. Let's move ahead, and now we have its clinical presentation. It again will be diagnosed clinically. So how will it present? So the patient usually will have a painful swelling in the eyelids, as we keep on saying it. Moreover, there will be since it is an infection by Staph aureus, so Staph aureus love to produce pus, so there will be purulent swelling, and which appears as an abscess, and that points near the base of the eyelash. It will present at the base of the eyelash. Now I have bolded so that you can differentiate it from the hordeolum externum. As you will see that these key points will be different over there. So do remember it, that in the hordeolum externum, so mainly the outer margins of the lid, so that will be involved, and at the outer margin you have the eyelashes. So at the base of the eyelashes there will be pus formation, as you can see over here. Moreover, the lid margins become red and edematous, so that since it is inflammation, so the lid margin will be reddish and inflamed, and the lesion may be solitary or it may be multiple as well. So you may have a solitary lesion or you may have multiple lesion around the lid margin. So just remember these clinical points, that there will be swelling, and this swelling will be painful. This swelling will produce pus, and this pus will usually present at the lid margin at the external side. Moving ahead, and now let's talk about the complications. So if you don't treat it, so it may lead to the preseptal cellulitis or orbital cellulitis. Now how to differentiate between these two? Let me remind you, and let me take you back to the structure of the eyelid that we have covered in the previous video. Let's take a little bit step back, and over here you can see, so this coming all the way from above, from the frontal bone, you can see that this is orbital septum that is coming, this thin line. So this is orbital septum, and at the lower end it thickens and form the tarsal plate. So this hole is your orbital septum. So anything before it, that is your preseptal portion, and behind it is your orbital portion. So Fence cellulitis, which is actually infection by the bacteria, so once that infection of the bacteria of the skin occurs before the orbital septum, so that is called as preseptal cellulitis, whereas behind it, it will be orbital cellulitis. Now over here it is shown again that here is your orbital septum. Now preseptal cellulitis, you can see the cellulitis over here, that is preseptal cellulitis, whereas behind will be orbital cellulitis. You can see this is the diffuse orbital cellulitis. Here is orbital abscess formation. This is the subperiosteal abscess, and it may lead to the cavernous sinus thrombosis as well. So these are the complications of the Hordeolum externum, and moreover their Staph aureus may infest systemically in the form of fever as well. So keep that in mind. So these are its complications of the Hordeolum externum: preseptal cellulitis, orbital cellulitis, and cavernous sinus thrombosis. Here is a diagram. You can see this is the preseptal cellulitis, which I have told you that it will be lying before the septum. So you can see this is preseptal cellulitis or periorbital, around the orbit cellulitis. Here is your orbital cellulitis. You can see the orbit inside is infected and inflamed. Moving ahead, now let's talk about the treatment of this stye. So the treatment is first of all, give the topical antibiotic to prevent the spread to the adjacent glands, since it is an infection by Staph aureus, and Staph aureus love to infect the glands and other structures. So give the topical antibiotic to prevent that spread. Moreover, systemic antibiotic to control the infection and prevent its systemic manifestation. So those should be topical as well as systemic antibiotics are given here, and moreover analgesics are given to relieve the pain. since it is a painful swelling, so you do give analgesics over here to relieve the pain. Moreover, the evacuation of the pus, that is the abscess drainage, should be done. So since the pus is there, so that pus should be evacuated from there. And if there is any we have just discussed it, that this pus will be centered around the eyelash, so that associated eyelash where the pus is present, so that should be pulled out, because you know that the gland of Zeus opens into the eye, into the hair follicle shaft, into the hair follicle, sorry, not into the shaft, so hair follicle, so it opens into the hair follicle, and so the pus is coming out from there. So if there is any eyelash over there at the base of which the pus is present, so you pluck that or pull it out, that eyelash, so that the drainage of pus can be done. Moreover, warm compresses are applied for about 10 minutes to improve the drainage, since we know that the primary cause is that there was an obstruction of that gland, which lead to the bacterial infection. So you should improve the drainage, and that is done by the warm compresses that are applied for about 10 minutes multiple times a day. So that is your treatment of stye. Now let's talk about Hordeolum internum. So we have just done with the Hordeolum externum, and now let's talk about the Hordeolum internum. So the Hordeolum internum, again, that was present outward the gland of Zeus, and over here we will have the gland involved. Over here will be the meibomian gland, which is present internally inside the tarsal plate. So the Hordeolum internum is actually the acute suppurative infection of the meibomian gland. Etiology, again, by Staph aureus, and pathogenesis is all the same, that there will be obstruction that will lead to lipid retention. The lipid retention will make it prone for infection. Staph aureus will be welcome in this environment, so Staph aureus will infect it. There will be pus formation, and there will be painful swelling. And this painful swelling, actually the pain will and the tenderness will be more severe than the Hordeolum externum. Why? Because the meibomian gland is large and it is embedded in the tough tarsal plate. So this will cause more painful swelling, more pain as compared to the Hordeolum externum. That's all about its pathogenesis, etiology, all the same. Now let's talk about the clinical presentation. So again, it is like the chalazion and Hordeolum externum, it is also diagnosed clinically. There will be painful swelling, as we have said that. Moreover, there will be purulent swelling. Again, since it is an infection by Staph aureus, so pus formation will be there, and the pus over here appears as a yellow spot shining through the conjunctiva. You can see the pus will appear as yellow spots that is shining on the conjunctiva on the inner side, and that you can see on the eversion of the lid. So you can see, we have studied that in case of Hordeolum externum, you will see the pus over here at the eyelashes, because of the involvement of the Zeus gland, whereas meibomian gland, which lie near to the conjunctiva in the tarsal plate. So here you will see the pus at the conjunctival side and more internally. Moreover, the tenderness of the lid will be there, the pain will be there, and this tenderness will be severe, as we have just said that, because it is present in the tough tarsal plate. So any compression over there or any touch, if you touch that area, so it will be tender and it will cause severe pain. Moreover, the lid become red and edematous, since it is inflammation, so the lid will be red and inflammation. So in order to diagnose it, remember, there will be painful swelling, there will be pus, and that you can see on the conjunctival side by eversion of the lid, and tenderness of the lid. So that's its clinical presentation. Complications are the same: preseptal cellulitis, orbital cellulitis, and cavernous sinus thrombosis. I don't think I have to go through them again, you know them. Now the treatment almost the same. Hordeolum internum, you give topical antibiotics to prevent to the adjacent to the spread to the adjacent glands. You give systemic antibiotic to control the infection. The analgesics are given to relieve the pain, and you have to evacuate the pus. Now, unlike over there, you can't evacuate it by plucking out the eyelashes, but over here you have to give incision on the conjunctival side by the eversion of the lid. Moreover, warm compresses are applied for about 10 minutes to improve the drainage, as we have done previously. Thank you. That was all about the Hordeolum internum as well as the Hordeolum externum. In the next video we will be covering our next topic, and that will be after the Calazion as well as after the Hordeolum. We will get to cover the next disease. Oh my god, I have forgot that name. Okay, thank you.